Hi, Dr. Baumholtz. Let's talk a little bit about silicone implants or breast implants in general. There's a lot of buzz lately about the dangers or risks of silicone implants, and I'm here to say that there is, to date, zero legitimate medical evidence that silicone implants make people sick. The other thing to know is that all implants on the marketplace today are typically two-part devices. I said all, and I said typically. So all implants are two-part devices. There's the shell, that's the part that you can physically touch. So in this case, here's a silicone implant. So what I'm touching is the shell and then the stuff that it's filled with. And so when most people say saline or silicone, what they really mean is what it's filled with, because the shell of all implants is made out of silicone. Now you can have a smooth shell implant or a textured, like a cat's tongue, rough textured shell. There is some concern with textured implants and a rare form of breast cancer. We will not use textured implants. We'll use smooth implants, so we don't have to worry about that. Okay. You are required to have surveillance of these implants going forward. This is not a lifetime device. At some point, the implant will likely need additional surgery. It may rupture. You may form something called a capsular contracture, which is a hardening of scar around the implant, or any number of things which we'll go through in the risks and benefits conversation and the consenting process. But 3 years after your implant goes in, and every 2 years thereafter, the FDA recommends an MRI. An ultrasound will work just as well in the modern era, but I want you to know what the current recommendations are. For my patients, we'll use ultrasound to screen them after their implants have been in place. If you have a saline implant, no special testing necessary. It's either up or it's down, and if it ruptures, you got a flat implant and your body just absorbs the salt water. If you'd like to know more about how we survey and manage implant issues going forward, please ask me as we go along. Okay, thanks so much.